Primary words: diabetes, cortisol, hypoglycemia. Secondary words: amino acids, glucose. Page title: Risk of diabetes. Psychological and emotional stress among mothers may trickle down to the kids and increase the children's risk of having diabetes. Mothers who experience distressful events such as divorce, domestic violence, mental tension and work pressure have an increased risk of developing diabetes. Parents who are often stressed out or are having problems is the number one stressor among children. Without the parents' knowledge, children may get stressed, raising level of cortisol, also called the stress hormone. Cortisol is found adjacent to the kidneys and is released in response to either physical or psychological stress. It breaks down muscle protein into its component amino acid, which then circulates the bloodstream. These amino acids are used by the liver in the manufacture of glucose for energy, increasing blood sugar level and at the same time lowering the use of glucose as fuel. The excess and deficiency of cortisol in the body may trigger some system disorders such as autoimmunity, damaging the insulin-producing beta cells, thus resulting in insulin deficiency. Children with diabetes who experience frequent episode of severe low blood sugar or hypoglycemia, particularly at an early age, may have reduced long-term memory performance than diabetic children who experience severe hypoglycemia at a later age. A diabetic children's spatial memory performance may be greatly affected by episodes of extreme low blood sugar. Hypoglycemia is an abnormally low level of glucose in the blood or low blood sugar. Anti-diabetic medicines that are taken orally by the mouth are effective as insulin injection in controlling symptoms of diabetes. The number of people with diabetes continues to rise while their ages at the time of diagnosis drop. Type 2 diabetes, which used to be called adult-onset diabetes, is now striking children, due largely to the obesity epidemic. Overweight and obese kids that present identifying symptoms like darkness around neck and armpits area are those who frequently get urinary tract infection, UTI. Diabetes, if not properly managed, can lead to many complications such as amputation and damage to key organs of the body like the eyes, kidney and the heart. It takes every ounce of restraints and discipline on the part of the patient to be able to follow the rigid diet and medication regimen required for the management of disease. Having diabetes requires careful examination of one's sugar level. Besides watching for sign of high blood sugar, they also have to be aware of warning signs of blood sugar or hypoglycemia. Using blood glucose meter, a person who has diabetes can tell her sugar level is low. Normal fasting blood sugar is 70 to 100 mg per deciliter.